Hi, my name is Lori, and I'm one of the dietitians and lactation counselors here at the Pueblo WIC office. Today I'm going to be guiding you through breastfeeding benefits and recommendations. So the breastfeeding recommendations are to exclusively breastfeed for the first 6 months, and that's recommended by all the American Academy of Pediatrics, the World Health Organization, and the Academy of Nutrition and Dietetics. And then the World Health Organization goes as far to say it's recommending 2 years of breastfeeding. But you can really breastfeed for as long as you would like to, just as long as you and the baby mutually would like to. So we're going to talk about colostrum. So it is called liquid gold. Colostrum is the first milk a mother makes. It's usually made within the 3rd month of pregnancy. It's full of antibodies, and it provides a protective coating for your baby's stomach. It's very thick and concentrated, and it's packed full of protein and nutrients, as well as a laxative, which helps get your baby off to a good start. It also helps the baby's gut be protected and finish developing after they're born. And it's really small amounts, but it's very thick, so it does provide a baby with the basic needs, allowing them to meet all of their requirements for nutrition and growth within the first few days until the mother's milk supply is able to fully come in. So baby stomach size. So whether you're breastfeeding or not, this is really important to know. Just to avoid overfeeding your baby. So when they're very first born, your baby's stomach is about the size of a cherry, so very, very small, which is why that amount of colostrum that your body provides is enough to keep your baby full. Really, and if you can't remember all of these different sizes, just think of the size of your baby's fist, and that's how big your baby's stomach is. So even at a month old, your baby's stomach is only the size of an egg, so it's still pretty little. And then this is important to know too, if you are bottle feeding, just so you know how much to put in the bottle and to avoid overfeeding, which can avoid spit up as well. Alright, so this slide kind of talks about the differences between human milk proteins and cow's milk proteins. So cow's milk proteins can sometimes be the cause of your baby having to transition different formulas a bunch because the baby is not able to fully digest it, versus human milk proteins, they're sized just right for your baby. And then human milk versus formula comparison. So this is a great comparison to look at. It talks about formula and everything that it provides, so minerals, vitamins, fats, DHA, ARA, carbohydrates, protein, and water, which is going to meet all of your baby's basic nutrition needs. But breast milk has a lot of additional benefits to it, such as antibodies, hormones, antiviruses, anti-allergens, anti-parasites, growth factors, and enzymes, which helps your body digest food. So really, human milk has 200 more nutrients than formula. The formula companies, because formula is manufactured and man-made, they're not able to replicate all of the benefits and those items that breast milk has in it. Alright, so here we're going to talk about some of the different breastfeeding benefits for mom and baby. Alright, so the mother's benefits of breastfeeding. It can help with weight loss. So it takes extra calories for your body to burn or to produce breast milk. And then it also helps your uterus contract faster and more frequently, helping it get back to its original size. It can lower your risk of type 2 diabetes by up to 86% per year that you breastfeed, which is really important because Pueblo actually has a 3 times higher rate of diabetes within the state of Colorado, so it will really protect you against that. It can lower the risk of certain cancers, to include breast and ovarian cancer. It can decrease breast cancer by 61% and ovarian cancer by 74%. Breastfeeding can also help with child spacing. That being said, I like to give a little disclaimer that you shouldn't always use exclusively breastfeeding as a form of birth control, but instead talk to your doctor about other safe birth control methods that are safe while breastfeeding and won't affect your breast milk supply. Breastfeeding, it's always going to be sanitary. You're not going to have to worry about washing bottles and making sure everything's clean. It's very convenient whether you're at home or out and about. You can always breastfeed your baby. And then less risk of postpartum depression, just because you get all those really good happy hormones when you're breastfeeding that can help with your mental health. And then it can also help lower your risk of cardiac diseases, osteoporosis, and it can help lower your blood pressure. All right, and then infant benefits of breastfeeding. It can boost their IQ, which is really important. It can lower their risk of type 1 and type 2 diabetes, which is important also for the baby because we do have a higher rate of people with diabetes in the state, or than the state average. So it is really important for the babies for diabetes. It's very easy for them to digest just because of those proteins. They're, made just for the baby. Fewer ear infections, healthier immune systems, which means you're going to be in and out of the doctor's office less often. And it can also lower the risk of asthma, allergies, SIDS, and also less stains and less laundry that you're going to have to do because breastfed babies don't spit up as often as formula-fed babies, which means you're able to keep them in the same outfit all day long instead of having to constantly change them. All right. So the longer a woman breastfeeds, the greater the benefits for mom and baby over their lifetime. So it is really a lifetime health decision, not just a here and now food choice. I know sometimes it's really hard to think long term when you're, really sleep deprived and, you just want to make sure your baby's being fed, but it is important to think about how formula versus breast milk is going to affect your baby later on in their life. That being said, though, any amount of breastfeeding is going to be beneficial to you and the baby. All right, and then I'd like to address some common breastfeeding concerns. So I'll go into that really fast. So there are some exceptions to breastfeeding that some moms might be concerned with, different medical reasons that you might not be able to breastfeed. So if you're on certain medications, and you can discuss that with your doctor or a lactation consultant. If you have HIV or AIDS, it's not recommended to breastfeed. Illegal drug use, and that does include marijuana. Marijuana does pass through your breast milk and would pass through to your baby. And although there's not a lot of research behind it, we like to play it safe and look at the research that we do have and not recommending marijuana use while breastfeeding. Radiation therapy, CMV, and active tuberculosis. So you would know if you have any of those conditions, and so you would need to discuss that with your doctor about breastfeeding with those conditions. All right. And so this is one of the biggest questions that we get is, I don't know if I'm going to produce enough breast milk. So a good statistic that might help make you feel a little bit better is really less than 3% of mothers cannot physically make enough milk for their babies, meaning that 97% of you can make exactly what your baby needs. Okay, so it's really important to know that if you do everything that we're going to suggest that you do with breastfeeding, you will make a good supply for your baby. So how do we do that? So just keep in mind it's going to take about 4 to 6 weeks to establish a good milk supply. Formula supplementation in the first few weeks will drain your milk supply. And that's because if you're giving a bottle of formula, you're most likely not breastfeeding. And if you don't remove the milk from your breast, you will start to lose it. So it's all about supply and demand. So the more milk that is removed from the breast, the more milk that your body is going to make. So if you look at this little chart, it shows you this lighter blue is breast milk production, and then the darker blue is formula. So the less formula there is here, the more breast milk that your body is going to make, because it means you're breastfeeding more. But then the more formula you start to add into your baby's diet, the less breast milk you're going to make. So you can kind of see the more formula, the less breast milk. So this is just really important. So just remember, the more you breastfeed, the more your body is going to make. Alright, so remember to get credit for this video, save the emoji you saw during this video to text us at the end of the 4th video. Okay? Thank you.